So we have the pleasure to hearing from our dear colleagues from Philips and many of their partners from the government itself around private-public partnerships using the Philips example. And how we're going to work this panel, I'll make some introductory remarks about the panelists in general, and then I'm going to hand it over to my colleague, Will Senner, who will do these sort of orchestral maneuvers for the panel. And then I'll take over after these maneuvers are finished, and then lead you in some question and answers, but I think it'll only take place after lunch. All right? So let's begin. Will Senner, a good friend of mine for many, many years. He's a U.S. Foreign Commercial Service officer by his training. He's served in many places in the world, and this is not on his bio, but Will, you can run, but you can't hide. Will is the head of international funding for Philips, involved in all the major institutional relationships Philips has with international institutions. So very, very important to have Will with us today, and he'll more or less chair that particular part of the panel. And then Luc de Klerk, who's the program manager and clinical lead for primary and community health care at Royal Dutch Philips. He started his career at Philips 10 years ago, and he's involved particularly with the EMEA, that is Europe, Middle East, and Africa, geography within Philips, and very, very happy to have you here. But he's also involved in giving training to, on a practical basis to midwives, to nurses, and to doctors. And then also introducing our colleague, Maria Rosa Coutillo. She's head of the Strategic Partnerships branch within UNFPA, deeply involved in that is UNFPA in reproductive health and maternal health as well, more broadly. She had a career in the private sector as well as the head of corporate social responsibility at Benetton Group. And she was the chief executive officer of Benetton's UNHATE Foundation. All right. Then we have Lamine Salem Ould Mujtaba. I'm sorry for the pronunciation, Lamine. But he worked, he's a country representative for UNFPA in the Congo. He was first regional advisor to the Office of Population and Development, and then he served as the representative in Chad and Sudan. Okay, then we have Paul Oyere Moke. He's the Director General of Population for the Republic of Congo. He's a member of the Country Core Group for the Learning Network for Countries in Transition. Codename LNSCT. Okay. He's a trained medical doctor and practicing in OBGYN. Patrick Balou is Secretary General of the African Construction Company, named in 2018 to be the most important construction company in the Congo. It's Philips' partner and distributor. There's a lot of other things about him. And then we have Thierry Kantebwe. He's the Chief Executive Officer of the African Construction Company, the same organization. He specifically has worked with E&I, which I think everybody knows is a large conglomerate in the Congo as well. So a couple technical issues here. A couple of our colleagues are not physically here, but are online by Zoom in principle. So that would be Lamine and Paul. I know that one of them has had connection difficulties. I know that's trying to be rectified. So if you hear strange voices, it's going to be them coming in on Zoom into the room. So without any further ado, handing it over to you, Will. Thank you.